welcome to this afternoon's webinar on webinar. I'm used to doing it online, on designing and delivering children's mental health services in the voluntary sector. We'll do some introductions, then we're going to do a little quiz with some chocolates prizes, just to kind of hopefully keep you all awake and stop you asking any questions because your mouths are full of toffees. So my name's Donna Ryan, and I'm the strategic lead for mental health, and I sit in the health directorate in Barnardo's. I'm quite new to Barnardo's. I've been there 4 or 5 months now, and I come from 30 years in NHS within CAMS. That's my background. I'll let our colleagues introduce themselves.
Hi everyone, I'm Lydia. I am a programme manager in mental health, and I work with Donna in the health team at Barnardo's, and it's lovely to be here today. I'll pass over to Tijan.
Hi, I'm Tijan. I'm a programme manager within the health team in Barnardo's, working alongside Donna and Lydia.
Over to you. You might have to shout or come back.
Hi everybody, lovely to meet you. I'm Preene. I'm a Children's Services Manager from Cumbria, overseeing 4 services that support children and young people. The social prescribing, child exploitation, youth crime, and a bereavement service for children who are affected by suicide.
Hi everyone, I'm Sammy Fitton. I'm the team manager for our Link social prescribing service for children and young people up in sunny Cumbria. Lovely to be here.
Okay, so we'll do a quick quiz. All we ask is that you put your hands up to the answer that you think is correct. So, what does Barnardo's offer? Do we offer health service development, policy influence, voice and influence of children and young people, parents, carers and families, social care services, or all of the above? Who thinks A? Who thinks B? C? Got some hands at the back, or are you just having a scratch? Yep, there's a hand at the back. D? Or E? Wow, there's a lot of chocolates going out, ladies. It is all of the above. We should have started with a harder question. You just have to carry on while I do it. So, when was Barnardo's founded? Was it A, 1866, B, 1903, or C, 1925? While they're coming around with the chocolates, who thinks A? Please note, ladies, I think there's some double chocolates coming out somewhere. B? Could be some double chocolates up there. Or C? Okay, it was actually founded in 1866. The gentleman's got 2 hands up, that's 2 chocolates. I think we've got someone who's quite competitive here. You'll have to get to the back. Run to the back. There were some right answers at the back. We're trusting you all not to cheat. I've got my eye on you, though. Okay. So the next question is, how many mental health and emotional wellbeing services does Barnardo's provide? 49, 61 or 84? Who thinks 49? Okay. Are you following? Who thinks 61? And who thinks we provide 84? We do actually provide 84 mental health services. No fighting, please. Okay. We have 84 contracts, and they vary from early intervention to acute, so things from like mental health support teams through to key workers sat in emergency departments and working alongside CAMS crisis teams. So of that provision, how many are mental health support teams? Do we have 13, 17 or 21? So who thinks we have A, 13? B, 17? And C, 21? 17. You'll be pinching those chocolates in a minute, won't you? We have said you should have copied him this time, shouldn't you? We have 17, and obviously that's just in England. The majority of those are in the north. We do have a couple kind of towards Birmingham way, but the majority are in the north region. And our final question. So in England, what percentages of ICSs do Barnardo's already provide services in? A, 46, B, 59, or C, 71? So who thinks A, 46? Who thinks B59? And who thinks C71? It is 71%. We are there with 71% of the ICSs already. We'd like to obviously improve that figure and move up in our percentage, but we are across 71% of the ICSs already. Okay, so just a bit of fun, just to open it up. I'll now hand over to my colleague Lydia. There will be a section at the end of all presentations for questions and answers, and we'll offer you more chocolates throughout.
Thank you so much. So our policy colleague from Barnardo today was due to join us. Unfortunately, they're not here. So any questions around policy, please do email us at the end. We've got contact details there and we can take them to our policy colleagues. But just to start off, what does the VCSE sector do in terms of children and young people's mental health, and how can we support? So something that we do at Barnardo's, and I know other VCSE sector does as well, is the role of policy. And that is creating new policies, that's developing and evaluating current policies that are already out there to understand the gaps that we can actually reflect on and do something about that too. In terms of what Barnardo's does, we create our own policies, but we also collaborate with others in consortiums to do that too. And we've always got a golden thread, which is children and people at the heart of what we do, as well as families, parents and carers. So we include those in terms of our policies and in terms of creating those as well. I've got a couple of examples of where Barnardo's has brought about change through policy work. One of the policies that we created was the mental health support team policy, where we spoke to children and people, teachers, commissioners, and other educational providers and schools to think about how can we ensure that mental health support teams can be continued and what recommendations can we take to the table. The way that we did that is produced a policy which was then taken to the Department of Health and Social Care, and recommendations were also discussed at NHS England too. In terms of the poverty and mental health, we understood that we're in a financial crisis at the moment, and the cost of living is actually really affecting some of our children and people and families too. And so what we did, we had a crisis is on our doorstep policy, which we included children and young people, giving them a voice at the policy table. And actually 30,000 petitions was signed in terms of free school meals, which children and young people and also celebrities took to Downing Street themselves to address. And we also have the online safety bill that we've been working on as a consortium with other partners as well. And that policy is around actually having age verification for online pornography web pages to ensure that children and young people are kept safe whilst at home and online too. So that is some of our policy work, but what else do we do? Well, we actually develop innovative models of care to support some of those real pressure points in the system. And we've got, as you know, many mental health programs, as you just found out, but we'll be concentrating on a couple today. One that I've been working on is in partnership with children and people, parents and carers, and also some of our colleagues in London. So Barnardo's has partnered with East London Foundation Trust, North East London Foundation Trust, and a community organisation called ELBA, or as known as East London Business Alliance, to create an early intervention digital tool on disordered eating and eating disorders. This is a web page, but it is being launched this month into an app, and children and people have also expressed that they would like face-to-face workshops in schools. So we're thinking about developing something as face-to-face workshops with mental health support teams too. That is currently being evaluated, and the evaluation will be completed this month to understand the initial thoughts and feelings of that Be Body Positive digital tool, but also to understand where we need to go next to ensure that effectiveness, clinical effectiveness, is thought about and measured in terms of children, young people, parents and carers and professionals too. The Be Body Positive tool, as mentioned, it is for children and young people that are suffering with disordered eating and eating disorders, but is also for parents and carers to get guidance and support to support their child and young person, and also professionals too. So if you're a clinician or a school teacher or anybody else that work with children and young people that are affected by disordered eating, body image and eating disorders, then you can go to Be Body Positive as a digital tool. We also have the Health and Wellbeing Alliance, and this is an opportunity where we can showcase how we work with other partners. So the Health and Wellbeing Alliance is part of the wider NHS England Wellbeing Programme, and Barnardo's has a consortium that focuses on children and young people. We have 13 localised small organisations that we work with, and Barnardo's are supported in them in terms of giving them some funding to roll out individual programmes in terms of support while you wait. Some of those programmes have really varied from social prescribing to talking therapies and everything in between, but that shows how we're working with our local providers to really ensure that we're meeting those local needs of those children and people and families too that are on the waiting list for CAMS services. Not only that has the consortium provided some support while you wait programmes, but they've also been involved in focus groups and bringing together some data in terms of reducing inequalities around children and young people's mental health, particularly with Black, Asian, minority ethnic groups. Some of those recommendations and some of that data that's actually come from those focus groups has been included in the major conditions strategy and also has been included in the mental health 10-year long-term plan too. So I'm going to hand over to Donna that's going to be talking about ACT. Thank you.
Thanks, Lydia. So our ACT service, our additional capacity team, this is a digital offer that Barnardo's have developed that is there to support pressure on waiting lists. So this model was developed last year and we started to roll that out this year. We're rolling it out initially in our north region, so that covers Cumbria, Lancashire, Northumberland, that north area. What we're doing first of all is rolling that out internally. So we have worked with our colleagues across Barnardo's who offer mental health support, mental health services and who have waits and waiting times. If the young person and family have agreed to a digital offer, then the ACT team can come in and offer the same digital offer as they would get face-to-face, but online. We've been running that now since September. I've had to look just so that I can clarify I've got the dates right. Since September, and we have over 6 services that we are supporting at the moment. The idea is that we can then scale this up. So we've just brought in a colleague to support us in the evaluation. We've brought in Edge Hill University who are coming to evaluate this service with us over the next 2 years. And then we'll be looking at how we scale that up internally and then how we look at taking that externally. The idea is hopefully that we can create some capacity for both statutory and non-statutory organisations who offer mental health services who have extensive waiting lists. At the moment, that doesn't relate to any neurodevelopmental conditions. This is around emotional disorders, and we hope to think about neurodevelopmental disorders moving further down the line. But at the moment, it's emotional disorders that focuses on. Hopefully, the evaluation will show that the like-for-like offer has the same outcome as the face-to-face offer from the digital, and that it is scalable, and it will show us lessons that we need to learn along the way. In regard to our mental health support worker, so this is a service that provides mental health support workers who sit within an ED. I've got eating disorder, emotional disorder, and emergency department in my head when I say ED. So I'm going to go to A&E because then I don't get confused, if that's okay. So the mental health support workers sit in the A&E departments. And they work alongside A&E colleagues and they work alongside CAMS crisis colleagues. We're currently running this and piloting this in the Black Country and also in St Helens. So in the Black Country, we already have existing a support worker service that works with our paediatric staff and our CAMS crisis team when a young person has been assessed by CAMS on a paediatric ward and requires some support or some input that helps them remain on that ward, helps the staff on the ward understand kind of mental health, because quite often there is a little bit of nervousness from paediatric staff towards a mental health condition or presentation. We work alongside those two teams and we support the family with any anxiety they have, we support the young person in their recovery, and we add that capacity to the paediatric staff and to the CAMS crisis staff. That's currently being evaluated as we speak, and hopefully we'll know the outcome of that soon. From this, we've then expanded that, and we've looked at how do we do this in an emergency department. So we have our mobilisation currently taking place in the Black Country in St Helens, And what they will offer is when a young person has come into A&E and they've been triaged and they're seen as having a mental health crisis, but don't warrant an admission to a paediatric ward because there's no medical condition for them to be admitted for, or they don't quite fit the criteria for a CRAMS crisis assessment, then we'll step in. So we step in and we do our assessment and we put a package of care around that family and that young person, and we support them and their discharge back into the community. So hopefully what both will do is alleviate some of those pressures on our statutory organisations, and particularly on our emergency departments or our A&E departments. We then continue to work with those young people and make sure that package of care is in place and is being successful. As I say, we're just at the mobilisation stage of that yet. We've not gone live. We're hoping to go live with that next month in October. And again, we're bringing in an external partner to evaluate that for us on our behalf. The idea is that we can learn, we can build that up, and then we can take that externally to our ICS colleagues and develop this model further. Okay. Shall we take some questions now on any of that? Or shall we go straight to Link?
Up to you. You go ahead.
We'll go straight to Link. Okay.
Hi everybody, lovely to meet you all, and just wanted to start by saying it's a real privilege to be here. For Sammy and I, this isn't what we do every day. We're very much on the ground back in Cumbria. So our presentation to you today is going to be about our Link social prescribing service. Just as a bit of an introduction, that this is Barnardo's first ever social prescribing service for children and young people. And much like some of the other services that we've heard there, we're looking at how we can roll this out nationally. And we're going to talk you through our service, what it is, what we do, and also bring to life a case study to make sure that young people are at the heart of what we speak about today. I'll hand you over to Sammy.
Hello. So yeah, just to give you a bit of a background on how our service was born. So we launched in September 2020, and actually our first staff were recruited the day that we locked down back in March 2020. So that kind of changed the journey that we've been on as it did for everybody during that time. So we started with 4 practitioners in 2 PCNs in Cumbria. We worked really hard to co-produce the service, so we managed to get into schools despite everything being locked down. We got into some hubs and we managed to speak to young people, we managed to speak to teachers, school staff, about what was missing, what the gaps were, what they needed, what they were struggling with, and that really helped us to decide what we were going to do in terms of the support we were going to offer. Since then, we've seen huge growth over the past 3 years, and we now work within 5 PCNs in Cumbria, and we actually have a pilot project in Lancashire as well. Okay, so how do we come about? So Barnardo's were actually approached by clinical leads in PCN saying that they noticed a gap in service provision for children and young people presenting at GP surgeries with low-level emotional wellbeing issues or worries or concerns. So that's where the partnership began. We offer support to children from age 5 to 19, and that was really important for us so that we kind of bridge the gap between child and adult services, so we can work with a young person up to their 20th birthday. So we have a wide range of practitioners. We have a very passionate, dynamic, dedicated team who work really hard to provide a bespoke service, and we'll talk a little bit about what our service model looks like shortly. And we are truly passionate and truly invested in improving the lives of children and young people that we work with. And an exciting development since this slide was done, we now cover the whole of Carlisle, which is a different demographic for us, being a more urban environment. I'll hand over to Vay.
So we wanted to showcase a video for you guys today. We thought that this would really give you a flavour of what the Link service is. So this video was created by Barnardo's a few months ago, so it's fresh off the press, and hopefully you'll be able to see the voices of some children and young people within this as well.
At Barnardo's, our goal is clear: to achieve better outcomes for more children. Every year we help hundreds of thousands of children, young people, parents and carers across the UK.
I went through a stage of grief, and then obviously just coming to school all the time just made that a lot worse. My mood was very low.
When I was in a very dark place, seeing a future was really difficult.
I didn't know where to turn, didn't know what to do, had no idea how to help Beth. So the first step was to go to the GP and to try and get help from there and see where we went from there.
At its core, the social prescribing for children and young people is about empowering those children and young people and supporting them to take charge of their own health and well-being now and into the future.
Together, we co-create a wellbeing plan with children and young people that identifies their strengths to help them understand and better manage what's happening around them.
When Lucy from Link first phoned me, she was like my guardian angel. She literally got me at a point where I didn't know what else to do. If I remember rightly, I think I probably cried down the phone to her.
Cumbria is a large rural county with lots of challenges for young people, like access to transport, lack of community activities and youth groups. This can impact on well-being and increase social isolation.
The social prescribing model allows us the freedom to do what's right for the child or young person and their family.
We were approached by the primary care networks to respond to these challenges. We talked to schools, community groups, GPs and young people to understand the problems so we could co-design a flexible, responsive service.
The support has been great because my attendance at school went from about 40-something% up to 93% as of recently, which is so much better and it's made school a lot more enjoyable.
Using the Barnardo CISO model, we're seeing firsthand how our teams have helped children achieve outcomes such as improved confidence, reduced anxiety and enjoying more fulfilled lives. Since 2020, we've worked with over 500 young people across Cumbria. Of those who have accessed the service, 88% felt less isolated, 78% have increased self-awareness and 66% have better relationships. Social prescribing is vital to getting more children and young people the help they need sooner.
Barnardo's bring with them a wealth of experience and expertise, but also their enthusiasm and their passion for children and young people really shines through.
It has helped me, get my life on track.